the Lighthouse, or the new name, say it one more time for me.
Lighthouse Guild International.
The Lighthouse Guild International. I actually think the merger is very exciting for services and programs for people with vision disabilities. Both organizations have incredibly excellent reputations and do great work. Some of it is different from each other, and I'm looking forward to seeing what happens with the merger of skills and caring from both organizations. And I just also want to recognize that the Lighthouse has been so generous in opening up this room and other rooms in the building for community events such as this. I can't even count how many events I have done in this building over the last 11 years, so thank you very much and your board, because everybody knows if you don't have community, yes, give them applause. If you don't have space to do community events, it's damn hard to do them. We have a huge turnout, as we can see, and I know more people are going to come. So I will tell you that, just quickly, with this is being co-sponsored by Congresswoman Carolyn Maloney, Senator Brad Hoylman, Senator Jose Serrano, who will be up here in 1 minute, Assembly members Dick Gottfried, Brian Kavanaugh, and Dan Court, Manhattan Borough President Scott Stringer, Council members Dan Garodnick, Jessica Lappin, Rosie Mendez, Community Boards 5, 6, and 8, Lenox Hill Neighborhood House, Manhattan Chamber of Commerce, New Yorkers for Accessible Health Coverage. We have a stupendous panel to present to you. We are going to be able to have time to take questions at the end. No doubt not enough questions. And the way that, particularly in large groups, it works most effectively is if you have questions during the course of this evening, write them down on the cards. Do people get offered cards at the front when they came in? No? We're about to pass them out. Not to worry. So there will be staff who will be passing out cards and taking back cards. If you can write your question on it, the clearer and more legible your writing, the more likely I'll be able to understand it and read it. And the reason we do this is it's actually much less time consuming, and because what I have found, especially in big groups, is 7 of you will ask the exact same question. And so if I see the 7 cards, I'm going, 7 of them have the same question, let's get that one done. So we actually find it's a very effective model when you have a big crowd and lots of questions. Please also know, in addition to the materials we had up there, have we run out of materials? Or they still have them?
We still have materials.
Okay, yeah. If anybody has gotten in here and didn't get the materials, please let us know and we can send it or email it to you afterwards. Again, our experts are going to share a lot of information. Some people have already said to me, this seems very confusing. Well, that's why we're having this kind of event. And the state of New York is working very hard to make sure that we create one of the best models possible under the national ACA or Obamacare, as it's called. 40,000 people have already enrolled, I just learned, in New York, despite some glitches with the computer system, confusion by people who aren't sure who to talk to. Now that's also the very good news. In addition to our panel of experts, we have navigators here on site who are happy to talk to people afterward and even schedule appointments for you to have your personal navigator help analyze the best options for you. I just want to recognize that the navigators, Manhattan Chamber of Commerce, Community Service Society, Center for Independence of the Disabled of New York, Community Health Project, the Actors Fund, Coalition of Asian American Children and Families, Lenox Hill Neighborhood House. Now, these are not the only navigators, but it's a nice mix of navigators from the Manhattan and actually South Bronx area. And you do not have to go to a navigator that is geographically closest to you, or a navigator that you think, well, I'm disabled, so I must go to the Sydney navigator. There are some special expertise that some of these groups may have, perhaps language translation. You'll be hearing more about that, but I just want to assure people that there are, for Manhattan, plenty of navigators for you to have access to And there's an opportunity for you to set up appointments here at the end of this evening. Is that right, Susanna?
Yes.
What didn't I say?
Well, we have time still.
Okay, fine. This is Susanna. She's like Madonna. She only has one name from my staff who does health policy and has talked to many of you on the phone, and I think we're making her an official navigator by now anyway. So we are delighted that you all will walk out of here having more information and knowing what to do. And we will still be available to help as much as possible, but you will feel that you are in a much better place to navigate this new system. And in fact, for many, many people tonight, you will learn that the marketplace, that's New York State's name for the exchange, is in fact offering you better health insurance than you've had, cheaper health insurance, or for some of you, the first opportunity perhaps in a while to actually have health insurance for yourself. Our speakers will be going in the order of, just to let you know, Alice Yaker from the New York State Department of Health, Director of Community Outreach, then Carrie Tracy, Health Initiatives Community Service Society, Marcia Okon, Marketplace Healthcare Counselor for the Manhattan Chamber of Commerce. It's been very exciting to see so many small businesses reaching out to my office already saying, how is this relevant for us? So I'm sure that there are some of you here, and I'm very glad that we have the perspective also from the small business world. I just want to recognize and invite to come up Senator Jose Serrano, whose district is just geographically north of my district in, I don't know, is it northern Yorkville, East Harlem, the West Side, the Bronx. They gave him a very funky district. Anyway, he's a fabulous colleague of mine if you haven't met him before.
Thank you. Thank you very much. And I want to thank Liz Krueger, your state senator, for hosting this event because, as she mentioned, I have a very large district geographically, covers a lot of areas, South and West Bronx, East Harlem, Upper Yorkville, Roosevelt Island, and the Upper West Side. So it's about as diverse as you can get. And one of the things that's sort of been tying my entire district together is I've been getting so many phone calls to my district office about the new healthcare exchange, Obamacare, what have you. What do the new healthcare, federal healthcare laws mean to me? How will they be administered here in New York State? And quite frankly, I was trying my best to wrap my head around it. And lo and behold, I find out that Senator Liz Krueger is going to put this forum together, and it couldn't have come at a better time. Not only because I could send my constituents to this event, but also it will help all of us understand better what is out there, what the new healthcare law will mean. Again, this speaks to the hard work of Liz Krueger and her wonderful staff. She is quite easily the best senator we have in the state of New York. I have to say, I mean, I call it like this. If there's been one event like this on a timely and important issue, there's been many. And this is something that is so important to the community, and it really is coming at the right time. So I'm very grateful, very thankful to Senator Liz Krueger and her staff for putting this together. Thanks.
No, I want to start saying something else. And then you just go away. So I just want to start by saying thank you to our hosts for this evening, for this home, this beautiful place and room that they've provided, and to all of you who have shown up. Susanna said we have huge registration, but there probably will be fall off. I don't think there's any fall off, and I think more people who didn't register have arrived. So I'm really pleased that you're all here, and I'm not only honored to be here, but honored to be a part of New York State of Health, one of the most exciting healthcare reform initiatives that we've had maybe since Medicare. So I'd like to start by showing you a short video that was produced for us. And it was our opportunity about 6 weeks ago, or 5 weeks ago, to introduce our new name, New York State of Health, our logo, our branding, and to give a sense of who we are as New Yorkers and how we're going to benefit from New York State of Health. So, the video.
We are a people who like to build new things.
We are people who like to build strong lives
And strong families.
We are a people who want to protect the ones we love.
We are a people who want the freedom to pursue new paths.
We are people who want to make our cities and towns,
farms and neighborhoods,
Places to thrive.
We are a people who just want to make tomorrow.
Better than today.
Give us the tools, we say.
and we'll take it from there. We are all kinds of people.
We are New Yorkers.
And when all of us have access to affordable health plans
and can choose the plan that's right for each of us,
we can do all these things more boldly,
More securely.
more confidently,
And more optimistically.
Than ever before.
Everyone deserves affordable health insurance. To find out how you or your business can get it, go to New York State of Health, the official health plan marketplace.
So we opened a week ago. We're in our second week plus 2 days. It has been an exciting, challenging time, as you all must know. But as the senator said, over 40,000 people have completed the application process and been found eligible for enrolling in a health plan. So that's been a good start, given all the challenges that we've faced. I want to be able to give you a bit of an overview of why New York State of Health was created and a really down and dirty of what it is, so that you come away from my presentation with a real concept and understanding of what this marketplace is about and how it functions. So we do know that 2.7 million New Yorkers under the age of 65 don't have health insurance. What you may not know is that these are primarily workers and their families. Basically, this pie chart just looks at what the uninsured rates are pre the Affordable Care Act, so you can get a bit of a sense of where the population basically is with the uninsured based on ethnicity, with a 34% of the Hispanic population being uninsured and the Asian Pacific Islander and Black non-Hispanic almost equal in their rate of uninsurance, lack of insurance. So this is the quintessential question, what is it? So essentially, it's an online marketplace where you can shop for a health plan, where you can compare health plans, apples to apples, oranges to oranges, and where you can enroll in a health plan that's right for you, based on your own medical needs, based on your pocketbook, based on what kind of benefits you're particularly looking for. I think that the most important point to get across from this slide is that it is a one-stop shop. So there is one web portal, there is one website. So whether you're interested in getting individual insurance or you're a small business that is under 50 employees, 50 or under employees, and want to get health insurance for your small business, you go to this one web portal, nystateofhealth.ny.gov. If you are eligible for Medicaid or CHIP, if you're eligible for some kind of subsidized coverage by the government, if you're not eligible for any kind of subsidy, you go to the same web portal. If you are eligible for public insurance or you're eligible for a private health plan, you go to the same web portal. It's all the same, one place, nystateofhealth.ny.gov. So basically this shows who is expected to enroll in New York State of Health. Our goal is 1.1 million New Yorkers, and that's over the course of 3 years, probably at this point anticipated to be broken up fairly evenly, although given the outpouring on October 1st, I'm not so sure about that. Basically, we're talking about 615,000 individuals and 415,000 people who come from small employers. The point that I want to make on this slide is that that 615,000 figure is really an enormous increase over what exists presently. So presently there are about 17,000 individuals who are who have a health insurance plan on their own. And the reason there are so few individuals is because, as many of you may know, the rates to purchase a health plan by yourself is enormously high. And so individuals remain uninsured because they can't purchase a health plan. So that's one of the reasons that this is going to change dramatically, and I'll talk a little bit more, as will my colleagues, about why the number will change so dramatically. Basically, if we take a look at enrollee demographics, 75% of individuals who are going to enroll in New York State of Health will be eligible for financial subsidies, tax credits. If you think about that, of the 615,000 individuals who are going to be enrolling, 75% of them will be eligible for subsidies. We know that this is going to be a real boon for many people, including people in the middle class. So that's really important. And the other thing I want to point out on this slide is that when we talk about small businesses, although it's 50 or fewer employees who will be eligible to go on the marketplace, into the marketplace, most small businesses in New York have 4 or fewer employees. So we're going to have a lot of businesses who are going to be interested in taking a look at the benefits of enrolling. And Marcia Okon from Chamber will talk to you more about that. So open enrollment began on October 1st. The initial enrollment period for individuals is 6 months. That's a very long enrollment period. It goes through the end of March of 2014. Somebody I spoke with earlier before our presentation started said that one of their concerns was they were getting all of these questions about how quickly people needed to enroll. Did they have to enroll October 1st or in October or in November? And it's important to know that if you enroll by December 15th, you will have coverage beginning January 1st, 2014. So for anybody who enrolls during these next 3 months, coverage will not begin until January 1st, 2014. And you need to enroll by December 15th in order to meet that next month's deadline. People who qualify for public insurance, for Medicaid, or for CHIP can enroll any month of the year, and similarly, small businesses can enroll any month of the year. They can choose when their open enrollment will be. So a little bit more about the portal. So as I said to you before, one portal will process all applications: Medicaid, Child Health Plus, Individual Marketplace, as well as the Small Business Marketplace. One of the parts of the program that I think is really exciting is that there was an understanding that enrolling in health insurance can often be a really daunting effort. Looking at what plans work best, trying to compare plans to be able to see what the differences are and what the benefits are for you and what you need, particularly for yourself versus what somebody else needs. And so the marketplace provides a whole range of support for your enrollment efforts. So you could sit in your living room and you could go online. You could sit in front of your computer, you could go online, and you can enroll yourself. And if you need some support, there's a web chat capacity, so you can ask questions and get your answers as you move along in the process. Or you can call a call center, which I'll tell you more about in a moment, and somebody at that call center will be sitting in front of a computer. They can answer your questions, and they can also assist you with actually enrolling in a health plan. And thirdly, and very importantly, there are going to be in-person assisters, and I think that Senator Krueger spoke about this briefly, and you're going to hear a lot more about it from Carrie Tracy from Community Service Society. These in-person assisters, also called navigators, in the future, they'll also be certified application counselors doing the same kind of thing, and brokers will sit with you, and they will walk you through the process. So you can actually sit with somebody in person and walk through the enrollment process, trying to figure out together what works best for you, what kind of financial subsidies may be available to you, and comparing the plans. That's the number for the Customer Service Center. I think that you all have my presentation, my slide deck presentation, so it's in there, but that's a number that you need to keep in your head. You can call that number from 8 to 8, Monday through Friday, and 9 to 1 on Saturday, and you can ask questions, as many as you like, call as many times as you like, and they can also help you with enrollment. You should know that, and I just got this information today, that the call center has provided assistance to 26,000 callers to date. So we're moving them right along. Just additional information about the Customer Service Center. Assistance is available directly in several different languages when you call. And if the language that you speak is not one that the call center has immediately available, they will connect you with language lines. So capacity is definitely there. So just briefly about the navigators, because as I said, you're going to hear more about it from Carrie. So New York State of Health sent out requests for proposals back in February to see what organizations might be interested in serving as navigators, with very specific criteria of what those navigators would need to do. And if any of you are interested, that RFP is on our website. And we got many, many, many applications, and 50 organizations were selected to be navigators. And within those 50 organizations were 96 sub-grantees. So some navigators, when they submitted their application, included other organizations within their application to kind of move more deeply into the community. So these navigators had to go through an extensive training to be able to really understand both what the New York State of Health was about, as well as the health plans, as well as how to deal with, consumers' concerns. We have to date, and again I got this information today, trained 500 navigators throughout the state who are ready to go to answer your questions, to take applications. Insurance brokers and agents, which you're going to hear more about from Marcia, also had to complete applications to become certified, and there are something like 2,500 certified brokers or agents who are ready to work with you. Some just working with the small business marketplace, others working with both small business as well as individuals. And they also had to get training. And the certified application counselors are going to be a little bit different than the navigators. Basically, the navigators are funded by a federal grant through the Affordable Care Act. The certified application counselors are funded by the organizations that they're affiliated with. So you might have certified application counselors that are going to be in hospitals or in health centers, especially the federally qualified health centers. This just tells you a little bit more about the in-person assisters. That takes in all of them. And I will tell you briefly that you have Susanna, who's been wonderful, wonderful, great support, has printed out a list of the navigators in Manhattan, in New York County. And on our website are the schedules for all these navigators, and I think that's part of the printout that you have. But I caution you, these schedules may change periodically, so if you're planning to go to a navigator to sit and talk through an enrollment process, call beforehand to make sure that navigator is cited where they say they're cited. So these are the qualified health plans. They also needed to put in applications to New York State of Health. We have 16 qualified health plans, and on the next slide, 10 qualified dental plans. Some of the health plans will have dental benefits. Those who don't can purchase a if you purchase a plan that doesn't have a dental plan within it, you can purchase a standalone plan if you choose to. These are the required 10 essential health benefits that every single health plan must have. And if you take a look at them, they're really very comprehensive. Whether it's maternity and newborn care or mental health and substance abuse, preventive and wellness services, and pediatric services, including oral and vision within the pediatric services. No plan that has been certified can not have all of these essential benefits. Some of the plans will have more, and obviously the premiums will be higher, but every basic plan must have all of these benefits. You know, a choice of plans in all areas of the state, and if you go on our website and go to New York County, assuming that that's where you live, you can see what plans are available in your county. So not every county has all 16 plans. So you can take a look and see what plans are available, but clearly this will give increased competition, which will give us all more options. When I talk to you about the 615,000 individuals who are going to be enrolling, that's our goal, it is anticipated that the individuals' premiums will be reduced by about 53%, which is an enormous reduction and will really open up the individual market as never before. And I think that we all know that through the Affordable Care Act, you can't be denied health insurance on the basis of a pre-existing condition. I talked to you before about how 75% of the individuals who are enrolling in New York State of Health will be eligible for some kind of financial subsidy, and this slide gives you a better sense about that. There are two kinds of financial subsidies. One is tax credits, and the other is cost sharing. So I will tell you that tax credits can reduce the cost of premiums. So for a single person earning less than $45,960, they will be eligible for financial assistance. And similarly, a family of four earning $94,200 will be eligible, may be eligible for financial assistance. It gives you a sense about how this really does impact not only on the poor who are uninsured, but on the middle class who are uninsured or looking for better insurance. Cost sharing is another way of getting financial subsidies, and that lowers co-payments and deductibles. And these tax credits can be taken immediately. So, for example, let me see if I can bring that. So, for example, somebody who sees a plan that whose premium is like $350 a month. And through the process of enrollment, they find out that they're eligible for a $150 tax credit. They can take that tax credit immediately and pay only $200 a month for their premium. So it's an immediate benefit. They could also decide that they want to wait till the end of the year and get the tax credit on their tax return. That's an alternative that they have, especially for people whose income changes over the course of the year or for whom they're not really sure about what their income will be at the end of the year. But basically, you could take your tax credit immediately. With the recognition that many people coming into the individual marketplace are going to be people who have not been in this insurance market before and may not have bank accounts, a provision was made that qualified health plan issuers can't discriminate against individuals without bank accounts, and there are a number of ways that premiums can be paid. The Shop Exchange, which is the small business marketplace, has tremendous value for small employers, less so in the major reduction in premiums that we see in the individual market, but much more in choice, in administrative simplicity. And again, Marcia will talk more about this, but basically an employer who wants to provide health insurance for its employees, whereas presently they might choose one plan for all of their employees, like one plan fits all because administratively that's all they can handle. In the marketplace, they can choose 5 plans because they will only get one monthly bill from the marketplace and they will only have to pay one monthly bill to the marketplace, and then the marketplace distributes the money to the insurers. So it makes it much simpler. There are tax credits, which Marcia will tell you about, and various contribution options. So there is a sense of much greater opportunity for small employers to take advantage of the marketplace in order to insure their employees. Just a little bit about the awareness campaign. So we've developed a strategic message, and there are a few things I want you to take away. One is that the marketplace is a gateway to affordable health care. We know that people who have health insurance have greater access to quality health care, and that makes for a healthier population. The marketplace is a gateway to that. We've tried to remove the hassle for both individuals and for small businesses, particularly by having it be one web portal and by having the support available. And having health insurance, for those of us who have had it, knows that it brings peace of mind, and it's a message that we want to convey, especially to young people who believe that they're invincible, they're healthy, there's no problem, why should they get a health insurance policy? Not only is it going to be potentially much more affordable than ever before, but things do happen. Illnesses happen, accidents happen, and for some amount that's affordable, they can have peace of mind. So you know that we've got this new name and logo. I hope that you've started to see some of the advertising that's been taking place on TV especially, and in the newspapers. There's going to be lots more. We have ads in newspapers. We have radio, which will be coming out probably in the next few months. It's important that you know that we've got these marketing materials, some of which are out there. Many of the marketing materials are on our website. I've brought you some English marketing materials. I think Susanna printed out some marketing materials that we have on our website in 7 other languages. And we will have all of these materials available in print within the by November 1st, actually. Those are some of the materials that we have. These are available to you. You can go on our website, you can download them, you can print them, you can distribute them at all the meetings that you go to all the organizations that you belong to. That's our website, as I've said to you several times tonight. I didn't tell you anything about the tax credit and premium estimator. Are you going to be talking about that, Marcia?
Not for individuals.
Oh, okay. So let me just tell you briefly about this tax credit and premium estimator. I should have done it when I talked about financial subsidies. You could actually go on our website now, and you can get a sense about what kind of subsidy you might be available for without starting to go through the enrollment process. It's a tool that we have on our website. It requires just a couple of pieces of information, and you'll be able to figure out from that basically what your subsidy might be. It may not be as close to what the actual subsidy will be, but it will be a very good estimate, and it's a tool that's worth looking at. These are just a summary, kind of 7 things you need to know. So if you have anything that you want to download and print out and distribute, these would be 7 things that I think would be really valuable. Ways you can help. You're all individuals, but you're all people who are involved with small businesses, with organizations, with houses of worship, with community groups. Help distribute this information. Whether somebody decides to enroll or not, they need to know that New York State of Health exists, that this is what it is. It's not a mystery. It's not confusing. It's basically, you need to convey that it's basically a web portal where people can shop, compare, and enroll in health insurance. And we need your help in conveying the message that it exists and it is worth everyone's while, whether you have insurance or don't have insurance, to take a look at what's available. And that's the number for the call center, and that's our website. Thank you.